in at work and you're interacting with your coworker and all of a sudden you realize that they're having trouble talking to you. And you're not really sure what is happening, but you also notice that they're having some difficulty keeping one of their arms up. It's as if it's so heavy they just can't support it by their side. What is going on, you wonder? Your coworker most likely has no idea what is happening or if anything unusual is happening. Is this a stroke, you begin to ask yourself? Most Americans delay when it comes to seeking treatment, especially in the case of a heart attack or a stroke. This is due to not only fear, but the lack of knowledge about these events. Majority of strokes are caused when blood clots move to a blood vessel in the brain and block blood flow to that area. And according to the medical surgical nursing, strokes occur when there is an inadequate blood flow to a part of the brain or hemorrhage into the brain that results in brain cell death. Without quick reaction times, the options for treatments decrease and the chance of death or severe side effects increase, such as brain death and paralysis of body parts. Emergency treatment begins in the ambulance on the way to the hospital. According to the Centers for Disease Prevention and Control, you need to be aware of when the symptoms began to help and aid the questions for qualification of specific treatments. With a quick response, usually at the hospital within 3 hours of the first symptom. Treatments such as TPA, which stands for Tissue Plasminogen Activator, can be used according to the CDC. TPA is used to break up or dissolve blood clots, which are the main cause of strokes according to the National Library of Medicine's website. An article on the use of TPA stated that only 15%, so that would be 15 out of 100 people, arrived within the 3-hour time window to be eligible for to receive intravenous TPA. Out of those 15, imagine only approximately 7 of those people being considered able to get that TPA. So 7 out of 100 is a very small number. The acronym FAST, which stands for face drooping, arm weakness, speech difficulty, and time to call 911, can be used to recognize a stroke. The American Heart Association says to spot a stroke, use FAST. Does one side of the face droop? Have the person to smile and see if the smile is uneven. Is one arm weak or numb? Ask the person to raise both their arms out straight in front of them, and does one arm begin to drift slowly downward? Is their speech slurred? Have them repeat a simple sentence, such as, the sky is blue. They should be able to repeat this back to you with no difficulty. If any of these signs or symptoms are present, you need to call 911 or get to the hospital immediately. Use the saying, time loss is brain loss, to help remember how important it is to react quickly to the signs and symptoms of a stroke. It is proven that fast reaction time can help save lives and prevent further damage to your body. So just remember, if you're thinking, is this a stroke? Act fast.